AI is becoming more common in aesthetic medicine, but here's the problem. Not all AI is built for healthcare. And when AI isn't designed for medical use, it's not just inefficient, it's a liability. We're talking about HIPAA violations, security risks, frustrated patients, and even lost revenue. Would you trust a generic AI tool with your patient's sensitive health information? Many clinics do without realizing the risks. That's exactly why today we're breaking down the three biggest dangers of using generic AI in aesthetics and why HIPAA compliant AI is the only way to protect your practice. I'm Jennifer Chen, founder of Modern Collective. I've spent over a decade helping businesses from startups to global brands streamline operations and scale sustainably. When I started working with aesthetic clinics, I saw the same problem over and over: incredible patient care, but behind the scenes, inefficiencies, overworked teams, and lost revenue. That's why in this series, we're cutting through the AI hype to show you what actually works so your practice runs smoother, not harder. Let's get into it. AI adoption in aesthetic medicine is skyrocketing, but there is a catch. Not all AI is created equal. Many AI tools require constant manual oversight. Don't integrate with your systems, or worse, put your practice at risk. Think about AI assistants like Siri or Alexa. They're great for answering general questions, but would you trust them to manage sensitive patient interactions, follow up on high ticket leads, securely book treatments? Yet many med spas unknowingly use AI that isn't designed for healthcare, leading to compliance risks that expose patient data, clunky workflows that slow your team down, or even worse, a frustrating patient experience that just feels robotic and impersonal. Let's break down these three major risks and why using the wrong AI could cost your clinic more than you think. When AI isn't built for medical use, it can create serious problems for your practice. And the worst part, many clinics don't even realize they're at risk. Here are three of the biggest dangers of using generic AI in aesthetics. Compliance risk. Many AI tools aren't HIPAA compliant, which means you could be exposing patient data without even knowing it. And when compliance violations happen, it's your clinic that's on the line. A frustrating patient experience. Ever spoken to a robotic chatbot that just didn't understand you? Patients expect convenience, but not at the cost of personal care. The wrong AI that doesn't streamline, it creates more headaches. If it doesn't integrate with your workflow, your team ends up fixing the mistakes instead of saving time. These issues aren't just annoying, they cost real money. Let's break them down one by one, starting with the biggest liability of them all: compliance risks. HIPAA compliance isn't optional. It's the law. And yet many clinics are using AI tools that aren't fully HIPAA compliant without even realizing it. What happens if you get audited, or worse, patient data gets exposed? Some AI tools aren't HIPAA compliant at all, putting your clinic at risk for fines, lawsuits, and loss of patient trust. HIPAA violations can cost up to $50,000 per infraction. A single mistake could be a five or even a six-figure financial hit. Even some AI tools that claim to be compliant, they're rigid, expensive, or hard to integrate. The right AI solution protects patient data while streamlining your workflows, so you never choose between security and efficiency. But even if compliance is covered, the wrong AI can still frustrate your patients. Let's talk about why that matters. Patients want convenience, but they also want to feel valued. You're a patient trying to book a treatment. Instead of talking to a real person, you get stuck with a clunky robotic AI that doesn't really understand what you're asking. Frustrated, you move on to another clinic that responds quickly and personally. Some AI tools are HIPAA compliant, but feel robotic and impersonal. Patients expect fast answers, but not at the cost of human connection. Rigid automation makes patients feel like just another number. When AI isn't personalized, patients get frustrated and book elsewhere. The right AI personalizes interactions, remembers past visits, and makes booking effortless without losing the human touch. Bad AI, on the other hand, doesn't just frustrate patients, it sends them straight to your competition. And even the best AI is useless if it doesn't fit into your workflow. Let's talk about the final risk: when AI creates more work instead of saving time. AI is supposed to save time, not create more work. But when it doesn't integrate smoothly, it does just the opposite. Have you ever used a tool that was meant to make your life easier, but instead it made everything else more complicated? Here's what happens when AI doesn't fit your workflow. So instead of streamlining tasks, bad AI adds another system to manage, leading to more frustration, more manual work. If AI doesn't sync with your CRM, your team ends up entering data manually, defeating the entire purpose of automation. Loss of patient information. If AI doesn't connect to your EHR, critical patient data details slip through the cracks. The right AI solution doesn't just automate tasks, it seamlessly integrates so your workflow runs smarter, not harder. So now that we know the risks, let's talk about the solution: AI that is actually built for aesthetic medicine. It's not just any AI, it's AI designed specifically for aesthetic medicine. HIPAA compliant and secure data handling, protecting patient data information without adding compliance headaches. AI that understands the patient journey, smart automation designed for consultations, treatments, and follow ups. Seamless system integration, works with your existing practice management tools. No manual work, no lost data. This is how AI should work, not as another tool to manage, but as a system that actually makes your clinic run smoother. How does HIPAA compliant AI actually protect your practice while making it more efficient? End to end encryption. Every patient interaction is protected, ensuring 100% data security and HIPAA compliance. AI assisted documentation, automating note taking and record keeping, reducing compliance errors, and saving staff hours of admin work. Automated consent management, tracking and storing patient consent for procedures, communications, and data sharing, so you always have the proper authorization on file and never miss an update. Secure automated messaging, keeping patient communication encrypted, ensuring follow ups, appointment reminders, and responses are always HIPAA compliant. It's about protecting your clinic, building patient trust, and making compliance effortless. Let's look at a real world example of why secure AI matters. Many aesthetic practices set up basic chatbots or generic tools to automate patient inquiries and follow ups. But soon, they may run into problems. The chatbot struggles with medical terminology, leading to patient confusion. It can't answer nuanced questions, so staff have to step in constantly. Patients can get frustrated, and some even complain about privacy concerns. When clinics switch to HIPAA compliance, aesthetic focused AI, the difference is immediate. Patients get accurate answers, leading to better trust and satisfaction. Staff spend less time fixing chatbot mistakes, freeing them up for higher valued tasks. Missed inquiries drop, and clinics convert more leads. This is why AI needs to be built for the aesthetic medicine. It's not just about automation, it's about creating a seamless experience for both patients and staff. Now, let's break down the biggest benefits of using the right AI solution. We've seen what happens when AI isn't built for aesthetics, but what happens when it is? Clinics using the right AI solution see game-changing results. Reduce compliance risks. No more guessing if your AI meets HIPAA standards. Security is built in. Improve patient satisfaction. AI that actually understands patients' needs, responds accurately, and feels personable. Increased efficiency. Eliminates manual tasks so your staff spends less time fixing AI mistakes and more time on patient care. But not all AI solutions deliver these results. So how do you know if you're choosing the right one? Let's break down exactly what to look for. Not all AI is created equal. So before you implement AI in your practice, ask yourself these 3 questions. Is the AI fully encrypted and HIPAA compliant? If security isn't built in, your clinic is at risk. Period. Does it integrate seamlessly with your systems? If AI doesn't sync with your scheduling, EHR, and CRM, it creates more work, not less. Does it enhance, not replace human care? AI should handle routine tasks, but your patients should still feel like they're personally cared for. If you're unsure about any of these, it's time to rethink your AI strategy. So, is AI the right move for your practice? Let's find out. AI is already transforming the aesthetics industry, but only for those who implement it the right way. Take the quick assessment below. If AI is a good fit, you have the opportunity to book a free AI audit call. On this call, we'll break down exactly how AI can help you streamline operations, reduce no-shows, and increase revenue without disrupting patient care. And don't miss out on the next episode. We'll be diving deep into how AI-powered automation enhances patient engagement and retention. Click below to take the assessment now, and I'll see you in the next episode.